Good day, everyone. Thank you for joining us again. My name is Rahul Goyal. I'm the clinical executive with Elsevier Clinical Solutions. I work as a family physician and in urgent care. And today I have a very great leader and a good friend, Dr. Tamara Sunbul, with us. Tamara, please introduce yourself to our listeners.
Sure. Similar to Rahul, my background is a physician, and as a physician, I'm very passionate about driving healthcare innovation to improve patient outcomes. I had the privilege of serving as the CMIO at Johns Hopkins Aramco Healthcare for over 30 years, where I led a whole range of digital transformation initiatives. And my role combined my background as a physician with my passion for healthcare innovation. And on a typical day, I work closely with the clinical teams and IT and leadership to bridge that gap between how we deliver innovation and digital health with how we make it work boots on the ground, ensuring that the digital tools and AI solution align with clinical goals. This involves everything from supporting a rollout of new technologies to developing strategies that improve patient care and empower healthcare workforce. And throughout my journey, I've worked to integrate digital tools that empower both patients as well as healthcare providers.
Thank you, Tamara. So you're a physician and a digital health lead. And from both those roles, what excites you and what concerns you about AI in healthcare?
Well, of course, AI's potential to just transform healthcare is really, really exciting. Tools powered by AI can help detect conditions earlier, personalize treatment plans, and even predict patient deterioration before it becomes actually critical. For example, in our EMR, we had implemented risk prediction. For example, risk of hospitalization for inpatients, and even on the outpatient side, a risk of type 2 diabetes complications. And these can proactively guide clinical decisions, preventing harm from happening, improving both the care scores of patients as well as the risk score of patients. Of course, this is a double-sided sword, right? So my concerns lie right now with AI in ethical transparencies and trust dimensions. AI models are only as good as the data they're trained on. So you have bias, data privacy issues, and over-reliance on algorithms without clinician oversight could risk compromising care quality. And it's that balance that we have to strike between automation and human judgment. That is what is critical. Another point I think is really important is how do we embed those tools, those AI tools into the workflow, right? So it might be the best AI algorithm, but if the clinician doesn't know what to do with that decision or what that entails, that is the problem.
Absolutely. And so if I was to say a call to action, what immediate steps should healthcare organizations and clinicians, professionals take to prepare their workforce for increasing the use of AI in clinical settings?
So I'll take that through the full spectrum. So starting with education and awareness. So AI literacy must become a core competency for healthcare professionals. Understanding the strengths, like we said, the limitations and the ethical consideration of AI is crucial. And I think that goes back to the way we, all the way from starting from medical school into our onboarded clinicians that we have to have this educational program for. And then we also need to have some upskilling programs because we already have we already have some AI algorithms that we've launched out, and so we should implement training programs that focus on data interpretation, clinical decision support, and the responsible use of AI tools. And we have to show them when we implement this to AI gives you this decision. What do I do next as a clinician? What does this mean? So it's bridging that gap with those training, with those upskilling programs. Of course, we also need interdisciplinary collaboration. So we should work closely. So AI is not done by the IT team or the data scientist or engineers. It's actually done validated by the clinicians at the bedside. So the clinicians need to check that this AI algorithm is actually delivering what it's intended to. So even though this AI algorithm might be FDA approved, it's mainstream, it's used in a lot of hospitals. Again, we need to have that recheck within the context of each hospital clinical area to make sure that the results are exactly what they should be, and that the clinicians are comfortable working from it from a data perspective as well as from a workflow perspective.
So, Tamara, coming to the patient experience, the most important part of any workflow is the patient experience and the doctor-patient relationship. How do you envision AI transforming that over the next 10 years?
So virtual assistants, predictive analytics, and remote monitoring tools will enable clinicians to anticipate patients' need, providing care beyond walls of the hospital, because we all know that healthcare doesn't happen in hospitals. It doesn't happen in clinics. Healthcare happens at home, at work. And a lot of that information doesn't flow into the clinician so they can take action. So in the future, we see a lot of that information and data being that's from home being pulled into sort of those AI algorithms so they can alert clinicians before either the patient develops a disease, predicting disease onset, as well as predicting disease complication. If a patient has a disease, that it predicts its complications. So that will help provide care beyond the hospital and clinic walls. But the crux to that, I believe that the human connection will remain at the heart of healthcare. AI should act as an enabler, allowing clinicians to focus on more meaningful conversations while automating administrative burdens. Like we said, getting rid of all that washing and cleaning and focusing on basically reviewing the chart, automations, administrative burdens, and alerting the clinician when things are not going as planned. And the key will be ensuring the AI enhances rather than replaces the empathy and trust that defines quality of care. And that's exactly what patients are looking for. So this is how we feel that AI will create that kind of proactive experience, along with, of course, personalized experience, because each person is different. Their genetic makeup is different. So even the same person might respond differently to one medication at different times of his life. So it's creating that more personalized kind of approach to each patient's care journey.
Thank you, Tamara. And if I was to summarize what we just discussed, it is that balance we need to strike. We need to be aware as well that AI is here and now, and we need to stop sitting on the fence and using it the best we can in our clinical workflows to improve the engagement with clinicians, with our patients, and to make healthcare more accessible, and use AI as a tool and humanize its use in our clinical workflows. Thank you so much for your insights and for your time, Tamara. I really enjoyed our chat.
Thank you for this opportunity, Rahul. It's been a pleasure discussing the exciting possibilities that AI brings to healthcare. And I can't wait till we see more clinicians adopting it